I want to talk about mental health in regards to not just anabolic steroids, but any sort of recreational drug or prescription medication that you can get from the doctor. These all can have adverse side effects, whether it's on your physical, your mental, it's depression, anxiety. We like to put a lot of emphasis on the physical in the bodybuilding world, whether it's like a health marker like blood pressure, harm reduction, tips, medications like telmisartan, echocardiograms, CT scans, ultrasounds of your heart, your kidneys. Those are all important, but we don't really talk about mental health. We talk about trend and we talk about the high anabolic use adding to like irritability. And that's all true. These things can increase it without a doubt. And some people are going to be more sensitive. So there are people who can take a gram of testosterone and they just have the mental side effects. So you got to take stuff long enough to see. So when you start a cycle, when you change a compound, when you change a dose or anything that can alter the brain chemistry, your hormones in your body, before they stabilize, it's normal to experience anxiety. And I think where a lot of people go wrong is they start something, they don't wait it out. They start equipoise 2 weeks in, and a lot of it's in your head, but some of it isn't. So you can't be swapping things out, changing things, changing the doses too often. You gotta let your hormones stabilize before you come out and say you can't take equipoise because of anxiety, because you ran 500 milligrams for 3 weeks. You know, you got to take stuff long enough. Like, I didn't start this video to push a medication or any sort of treatment. I just think people need to be aware that there are options available. You don't want the gear tearing into like your relationships, which happens all the fucking time. People know it in this industry. It's just something that comes along with taking gear. Now, some people are less affected by it and some people are more affected by it. So you need to consider these things. So does it mean you have to stop? If this is something, I don't know, you want to do, you got to look into different treatment options, just like blood pressure medications. If you want to keep taking gear, but you're hypertensive, either going to stop the gear, change the doses, or add in a medication. And I can't tell people what to take or, give them a treatment. You need to see a medical professional before anything is considered. You cannot get on here and tell people, start a fucking depression medication. Start, Paxil, citalopram. I don't fucking know. I'm not in a spot to do that or to suggest that. There are people that ask me about it and they're just curious. Health insurance is a thing. Some people can't afford the therapy, the medications. So that's another thing that needs to be considered. How much is it affecting your life? How much is the gear? You start taking gear and you're fucking been with the same girl for 6 years. No issues. You start gear. Next thing you know, fucking 6 months in, your relationship's over. So that's what I want people to avoid. You don't want it just, putting your life in fucking shambles. Okay, so there is therapy, there is medications, change the doses. These things have to be considered. So I think it's important just to push that out there for people to know about. So that's the video. Appreciate you guys watching. Thank you for the support. See you guys in the next one.